Good morning to you, Laura. As you mentioned, some of the cancers here are not as common as others that we hear more about. The teal bracelet that represents ovarian cancer, not as recognizable, but for families who've been impacted by a gynecologic cancer like mine, the impact is significant and forever changes you. Now, gynecologic cancers are often thought of to be somewhat broad because it talks about different parts of the female genital tract, but there are some types of cancers that are more common and present important red flags.
Cancer mortality in women tracked until 2019 is still widely caused by lung cancer, followed by breast, colorectal, and then pancreatic cancers. Then comes the most common gynecologic cancer in the U.S., uterine or endometrial cancer. Dr. Lee Mei Chen of UCSF's Gynecologic Oncology Department says, as with all cancers, the key to reducing your risk for advanced disease is knowing more about yourself and your family.
Abnormal bleeding, pelvic symptoms, bloating, distension, those types of symptoms should warrant assessment and evaluation by a women's health provider.
There are three big cancers within gynecologic oncology to consider. Uterine cancer is the most common of these cancers and is usually associated with a hormonal imbalance. It can also be linked to hereditary cancer risk, but many times obesity can increase your risk.
Most of the time, uterine cancer presents early and is treatable through surgery. But with advanced disease, uterine cancer can still be quite deadly.
Ovarian cancer has traditionally been thought of to be the deadliest in the group because it presents at a more advanced stage. Symptoms can be subtle and vague. These include bloating and distension. A quarter of ovarian cancers are associated with family history. The third type to watch out for, cervical cancers. Here in the U.S., HPV vaccination is routinely recommended for both males and females. Pap smear screenings are a big part of early detection because it helps identify early lesions even at a pre-cancer state.
But gynecologic cancers sometimes are, eschewed from conversation because they're down there. They relate to parts of the bodies that people, have less awareness about or are less familiar with.
Which is why awareness of your own body, your own anatomy, and awareness of symptoms can really help identify at the right time. Now, Dr. Chen and the team at UCSF say research is key in advancing therapies that extend people's lives and hopefully prevent disease progression. Laura?